This is the VoiceOver Marketing Podcast, Episode 7.
Okay.
Foghorn.
Nice. How about one of those?
We could do that.
Okay.
Hello and welcome to this episode of the VoiceOver Marketing Podcast. My name is John Melly, and this is the podcast dedicated to teaching in-depth and advanced marketing strategies for people in the voiceover and audio production professions. My goal is to help you make more money by showing you ways to leverage your time, charge more for your talents, and allow you to spend more time doing the things you want to do in your life. Hello, everyone, and greetings from Boston, Massachusetts, and welcome to the program. We take a little bit of a turn during this episode, but it is loaded with great information about one of our best business assets, our voices. If we don't keep that healthy, we don't earn. My guest today is Dr. Ahmed Abdallal, a speech-language pathologist from Bridgewater State University in Bridgewater, Massachusetts, and we're going to be talking about the health of your voice. We're going to be exploring things like what the pitch of your voice may indicate for health problems, how we communicate with pitch changes in our voice, and how early we start to learn how to do this. How doctors are using voice recordings to diagnose Parkinson's disease and other diseases way in advance of other tests. We're going to talk about if there are peak hours for your voiceover performance, how to massage your voice. Have you ever heard of third-hand smoke? And how sleep repairs your voice, and much more. I think you're really going to enjoy this interview, so please stay tuned for that. Before we get started, I have a few announcements. First, this episode is sponsored by the upcoming VoiceOver Virtual, the online voiceover conference, hosted by VoiceOver Extra. This event is going to be really cool. In last episode, I interviewed John Florian, the creator of VoiceOver Extra and the host for VoiceOver Virtual. If you want to learn more about it, go to episode 6 at voiceovermarketingpodcast.com. There are going to be more than 50 presenters on various topics in voiceover, business, marketing, legal, how to get into audiobooks, how to get agents. It's going to be for different levels, beginner, intermediate, and advanced pro. So there's going to be all kinds of courses that you can take advantage of. Go to episode 6 to learn more. I'm going to be a presenter at the conference, and my presentation is called How to Build a Six-Figure Voiceover Business Without Spending Your Entire Day Auditioning Online. I've just put the finishing touches on the presentation and sent it off to the folks at VoiceOver Virtual. During the presentation, I'm going to be peeling back the curtain on some of the key strategies that I've used to build my business, one of which is showing how I use the story of my getting started in voiceover to actually grow my business and how you can do the same. There's an affiliate link to the VoiceOver Virtual registration page in the show notes for this episode. Just go to voiceovermarketingpodcast.com and click on the VOV logo to register and to learn more. Shifting gears, I'm really excited and honored that we have had over 2,100 downloads of the VoiceOver Marketing Podcast, and your comments have been very positive. One of the things that I've been asked in some of those comments was to share some basic marketing tips and techniques to help people grow their business. Last episode, I shared the So That technique that helps you find the main purpose for your business. Why are you doing voiceover for a business? Just go to episode 6 to hear more about that and see how in the show notes. In this episode, I want to share a different marketing strategy with you. And that is, it may sound simple, but it does take a little bit of time. It's defining your target customer. Who do you want to serve? This is something I go into great detail in my presentation at the VoiceOver Virtual, but defining who you want as your customer can do great things for your business. You can't nor should you be all things to all people. So ask yourself, who do you like to be around? Who's your ideal client? What interests do they have? What hobbies do they have? What do they read? Are they civic-minded? Are they politically active? And if they are, which way? Are they liberal, conservative? Do they exercise? What other interests do they have? Now, knowing this allows you to introduce these interests in your marketing and makes you more relatable to your potential clients. When you do this, they find out that they share common interests with you and that you are more like them. Now, people like to do business with people they know, like, and trust. People like people who have similar interests. These similar interests are what are called paths of entry. Now, for example, a path of entry for me might be considered an interest of mine is music. Now, let's drill down on that some more to show you what level you can get to. Particularly, I like rock music. To narrow it down further, you could say progressive rock, and ultimately the band Rush. Now, tangentially, I love drumming and percussion because I play the drums. And anybody who knows anything about Rush knows that their drummer, Neil Peart, is probably one of the best rock drummers of all time. Why am I sharing this with you? Well, if you or someone else were to send me something that had information about drumming, or particularly the band Rush or Neil Peart, I would stop and pay attention to whatever that thing is. I wouldn't just gloss over it. It would grab my attention, and I would read it. And if it had something of interest to me, I would follow up on it. So if you can relate on that level with different interests, whatever they may be, to a target audience you want to work with as clients, you'll do more business and you can charge more for a defined market rather than trying to appeal to everyone. Here's a good example. Most fast food burger places appeal to the masses and sell a lot of burgers at really low prices. Well, there's a restaurant here in Boston called Moo. It's a high-end steakhouse. Now, Moo Restaurant on Beacon Hill in Boston is not about appealing to the masses. Yeah, they're going to sell you higher quality food and premium single malt scotches and steaks at higher prices. But they're also going to give you a fantastic dining experience, and their marketing appeals to people who are willing to pay for that. And more importantly, Moo knows where to strategically place that marketing in places they know where their target audience will see it. Take some time and think about who you want to work with and define that. It's huge. It also makes your business more fun, and it helps you to actually say no to people and opportunities that aren't a good fit for you. Next episode, I'll tackle another marketing basic for you. If you have a question or a comment about what I've shared with you, please submit them at voiceovermarketingpodcast.com and look for episode 7. Now with that, let's move on to the part of the program where we meet our special guest, Dr. Ahmed Abdallal. Well, welcome back. As I said in my opening, my guest today is Dr. Ahmed Abdallal, who's an assistant professor of speech-language pathology at Bridgewater State University in Bridgewater, Massachusetts. He also works as a pediatric speech-language pathology consultant, and he provides clinical consultations for various school districts in southeastern Massachusetts. Basically, he's a pretty smart guy. And the reason that I have him on the program today is he wrote an article in the Bridgewater Review. My wife, Ann, works at Bridgewater State University, and she left this out. And the title of the article is Voice as a Parameter of Emotional and Physical Health. And I went through this, doctor, and I was fascinated with a lot of the different things that you can talk about. Vocal folds serve as life preservation and speech functions, the vehicle to convey emotions and attitudes. And I want to talk to you a little bit about that because that pertains quite a bit to voice acting. But you had some other stuff in your article that was really interesting, too, about voice quality and what pitch can reveal about your health. Not just your vocal health, but your overall health. And you even talk about how you can test for Parkinson's disease through voice and some other things that we can do to take better care of our voices. So I want to thank you for taking time out of your busy schedule. You are a busy man. It took a while to get this coordinated, but thank you for coming to the studio today.
Oh, thank you for having me, John.
So I guess, Doctor, what I want to ask you is, how did you first become interested in voice and linguistics?
Initially, through the master's program, you look at areas in the field where you can produce like the greatest impact and you can make the biggest difference in for someone's life. And looking at voice, it is very scientific, and the fact is, if you know the anatomy and the physiology, it becomes a matter of 1 + 1 = 2. The diagnosis would become, quite clear to you if you know the anatomy and how muscles and, for example, and the larynx, how they function. it would be easy to make a diagnosis. And this way, once you make the diagnosis, you feel like that aha moment and wow, I made a difference for someone. There are other areas in speech pathology, but voice is one of the exciting things. And there are new things every day that speech pathologists add to what they do in terms of voice treatment and diagnostics.
So we had a conversation prior to our interview today, and you were telling me some interesting things about tone and pitch characteristics and the ability to convey emotion. And you were doing some interesting work with people with Asperger's syndrome. Am I correct in that?
Yeah.
Yeah. Could you talk a little bit about that and how this all helps them with whatever treatment they're receiving?
People with Asperger's disorder and, some others, for example, say with depression, where they have the tone of voice, they cannot modulate pitch or monitor the pitch of voice and the tone so that, to express to you, for example, I am asking a question, I'm not making a statement or the opposite. And in some cases, you say one sentence, it could be used as a question and as a statement. It depends only on the intonation, on how you modulate your pitch at the end. So this is an area that would cause, for example, someone to misunderstand the joke or to misunderstand the intent of the speaker. And it would cause social difficulties in making people not get along with others because they might think that the tone of voice is not, it indicates maybe aggression, or it indicates like the person doesn't like, what is being said. So there are areas, like say in the right side of the brain, that modulate the ability to actually express yourself, your emotional content, and another area that enables us to understand other people's, voices and what the tone indicates to us. And then some people would have difficulty with that.
How is it that we know what a pitch means? How is it that we come to know that a raised inflection at the end of a sentence implies a question? How does that all happen? Is that something that we learn as we learn the language growing up, or is that just something that's intuitive?
Well, this is basically we acquire it as soon as we are born.
Okay.
And about 2 months after birth, up to about age 8 or 9 months, children have a very acute sense of that, pitch, like variations and small changes in pitch. Babies are very like specialists in that. Once they pass a year, then they become insensitive to these little variations. And that is very important because it imprints in their brains the subtle changes in speech, and it gives them the ability to have the melody of speech like a native speaker does. So it begins very early in life, and based on what culture you are, for example, growing in, you obtain these sound differences and sound pitch variations, and then you grow up instinctively knowing how to modulate your voice and how to comprehend and associate it with the meaning that you have in your environment or with your culture.
Okay. That's an interesting thing, because I don't think you're a native speaker of English.
Right.
So was it a real challenge for you to learn the differences in pitch when you were learning English as a language? I know it probably varies from culture to culture. Like, how much of that came into play when you were learning English, if I could ask the question?
Yeah, certainly. The fact is, this is a very, very hard area. And the language is not about just learning vocabulary and putting that to make sentences. I remember when I went to choose a topic for my PhD at Cairo University in Egypt.
Okay.
The professor told me when I came up with studying tone, and she said, well, do you mean like the tone of voice? I said, yes. She said, you need to go to a country like America or Britain and to stay there for at least 7 to 10 years.
Oh, wow.
Before you are able to actually get the concept, just hear it from native speakers and internalize it so you can analyze it and study it. And indeed, it took that long.
Yeah.
It took that long, at least 7 years.
Yeah, and I was reading an interesting book, The Talent Code. Have you read about that, with all of myelin and the growth of myelin and how the different neurons, as you practice a skill, that the myelin around the neurons gets thicker.
Yeah.
And it's all about how you can grow myelin from birth till death. You're still growing, but it does slow down after a certain age. But that any skill practiced over and over helps grow that, and it basically insulates the neurons. And so it does talk about the length of time. So if I could ask, when did you kind of think, okay, I get it now?
It was actually, after getting into speech-language pathology.
Okay.
Linguistics is an area that is quite interesting, but it doesn't have the anatomy. It doesn't have, all this. So in order to understand this really technically, you need to understand the mechanism that actually makes it. And then you become kind of studying things from a metacognitive perspective, like looking at it and how it works and internalizing it on yourself and saying, how am I doing? And looking at others. I remember at the beginning of my career, I would, sit by myself in a room and have these tape recorders and record for myself, like before doing a presentation or something like that. And it took many, many years, but also through the patients that I have treated over the years.
As you're just saying this, I'm listening to you, and it's so subtle and so pervasive in language. When the way you said it, and it took many years.
Yeah.
It was the way you raised your pitch, and the word "took" implies like, I had to put some effort into this thing. But that's all the subtle cues that are implied in our language that help create more of a complete message than just, as opposed to saying, it took many years for me to do it. If you said it that way, it'd be kind of like, it wasn't a big deal. But because you raised the pitch and the word "took," it implied like, this wasn't easy.
Yeah, indeed.
But we all understood that.
Yeah.
And that's the fascinating thing. I think that's kind of cool, and that's probably why you love it so much.
Yeah, it really is really fascinating. At some point, like, for example, especially if I don't sleep well or if I'm really exhausted, sometimes when I say something to my wife and she's not there, like she's not close, and I would have to raise my voice for her to hear me, that little pitch thing kind of disobeys me. And, she'll say, why are you mad? And I don't really mean that. I just mean raising my voice to say, you didn't hear this, so here it is.
Sure.
So this area of pitch and intonation is one of the hardest because, if someone comes to, say, America or you learn a language as an adult, like after 14 years or 16 years of age, it doesn't matter how much you try. It stays, and this is what reveals, most of the accent.
It'll always be noticed by a native speaker that you're not a native speaker. Is that what you're saying?
Yeah.
Okay.
Yeah. And that is one of the main areas. It is not the words or the sounds. And you think, like, say, Henry Kissinger. I mean, he's been longer. He has lived in America longer than he lived before,
right.
In other countries. And he still has that. And it has to do, the time that we reach puberty, the brain and the nervous system would have established some kind of, it becomes like hardwired.
Right, yeah.
And after that, you could do some modulation, but I think if you learn so much out of America, you want to speak English, you learn so much English outside of America without having the appropriate models, you learn the wrong way.
Yeah.
You come here, it becomes harder, and it will be harder to undo that accent.
Sure, and the same thing would happen for us if we were to go to Egypt.
Yeah.
That's cool. And all this stuff applies to voice actors because what we're trying to do is impart messages and cues through a script to an audience without pictures.
Indeed.
Everything that we're doing is, unless you're, if you're voicing something for television or a video or a movie, then the pictures are there to help someone convey the message. But for radio or podcasts or when it's all audio and nothing else, all we have really is our ability to change our pitch to get the message to come across. So.
Yeah, it really is, like you said, the point is you have to do a lot if you are just doing it by voice, because most of conversation, most of the meaning is nonverbal. More than 60% of what we say is nonverbal.
Okay.
So you might say something, I could look at your face and you are pretending. I could tell you are pretending, or your body language and all of this. But it takes a great skill, for example, to do it only by voice when you do not have any of the visual, cues.
Right. So talk to me a little bit about, I'm going to go through your article here, what voice quality and pitch reveal about your health.
Well, for example, the vocal folds are supposed to be quite smooth at the edges. They have a very thin, rubbery, we call it mucosa. Mm-hmm. And it's like the same substance like the lining of the inside of the cheeks.
Oh, okay.
And anything that makes it uneven or makes one side of the vocal fold heavy, it's going to make a difference in pitch. It will lower the pitch. And when that happens, that's an indication when you hear someone speaking in a low pitch, that's an indication that mucosa is not functioning appropriately, that the vocal folds are not closed and sealed completely. And then you just try to find out why that is the case.
Okay.
And it could be anything ranging from vocal fold paralysis to a cyst or to cancer, laryngeal cancer, and any number of disorders. There are so many vocal fold problems that happen as a result of papillomas or cysts or vocal nodules, like so many of them. Mm-hmm. And just listening to the change in pitch is going to indicate, is that a problem that we need to look at to see maybe, the person is developing, say cancer. Mm-hmm. If that person is a smoker and they start having this, it could be, or Reinke's edema, which is the smoker's kind of edema. So the diagnosis in that case would become, someone's life may depend on that. Mm-hmm. And they would have to go to be checked by an ear, nose, and throat doctor and by a speech-language pathologist, and to see exactly if it is Reinke's edema or smoker's edema. There's a lot that can be done, but of course, obviously, they will have to give up smoking.
Yeah, that's the best thing you could do. Stop that.
and they will, of course, biopsy the tissue, and if it is laryngeal cancer, then the options, of course, if you catch it earlier, mm-hmm. you are going to extend your life.
Sure.
But the idea of voice, when you listen to it, even in diagnosing Parkinson's disease, the technique that they come up with last summer, Dr. Max Little and his colleagues at MIT, they hooked that machine, we call it the VisiPitch, which is when you use a microphone, you see a screen, and you see your pitch going up and down.
Sure.
And we measure something called shimmer and jitter. These little changes between cycles of vibration in loudness and in pitch. And they would indicate how the vocal folds are functioning. Very subtle changes in these shimmer and jitter will indicate that the vocal folds are not doing the cycles the way that they should. So in Parkinson's disease, the vocal folds could be the earliest indications of some change in muscles, because it begins in very sensitive muscles and then it generalizes to the body muscles generally.
Oh, okay.
So they did the experimental phase last year on 10,000 patients, and the accuracy rate was above 98%.
Wow.
So they hook it to an answering machine, and the person calls a number, and they would speak for 30 seconds. And then the VisiPitch and the instrument is going to analyze jitter and shimmer, and then they would say, this is an indication of, say, Parkinson's disease. It will reduce the expense dramatically for the medical expenses, but it's at this time they're trying to make it patented and
sure.
Market it.
How will it reduce the expense medically for people who have Parkinson's? Just because you catch it earlier?
First, the diagnosis itself, having to go to different specialists.
Oh, okay.
And also, it wasn't like you didn't have something definitive initially. Mm. But this is one of the most reliable diagnostic tools. And just 30 seconds, use on the phone, that could, give you the diagnosis, and it is very accurate. Mm-hmm. Of course, it doesn't require, you will have to see a neurologist, you will have to see a voice specialist, but there will be a lot of the expenses that will be eliminated in terms of when you come up with the diagnosis.
This is fascinating. So we've talked a little bit about smoker's edema and Parkinson's. What are some of the things that voice talent and people in general can do to keep their voices healthy?
Well, there are the things that we can do on a daily basis, on a regular basis. First, we know our limits. Everyone's vocal folds are different. And we should know exactly, for example, how many hours does it take me to reach a level where I feel I'm strained or I have strained my voice. So knowing that, we can plan accordingly. Say, instead of speaking for 6 hours a day back to back, we can space out our speaking engagements. Or say, for example, that you have scheduled everything on 3 days. Maybe schedule things, add one more day to reduce, instead of 6 hours a day, make it 4 hours a day. Also, doing things in terms of like keeping your vocal folds hydrated. Taking a sip of water once in a while throughout the day, especially in hot, dry days. Because when we speak and the vocal folds keep slamming against each other every time as we speak, it heats them up. And when they are heated, they become dry. Okay. And when they're dry, the tissue that is dry and it keeps, being slammed against other tissue, it causes ulceration and the vocal nodules.
Oh.
And when the vocal nodules happen, if the person doesn't change his or her habit of speaking, that will continue. It is not going to go away. The vocal nodules are like two little ulcers on either one side or two sides, and they will prevent the vocal folds from completely closing, which causes leakage of the air. And the person will maybe run out of breath in the middle of a sentence, or they have to breathe more.
Oh, okay.
Even if they have to push, or exert effort, they would not be able to fully seal. So drinking a little bit of water once in a while is going to create that mist around the vocal folds, and it will make the impact less, as we speak.
Kind of like cooling the engine down.
Exactly. I say sometimes, like when you use a tile cutter, you cannot do it without having water around the blade.
Right.
Because it's going to spark and make... so this is why they put water to absorb, the heat.
Okay.
As you speak. And also avoiding drinks like, say, coffee. If someone has a voice problem or they feel that their voice doesn't last long throughout the day, they maybe, and if they are drinking a lot of coffee or alcohol, they can reduce that, because these products are diuretic products. They drain water out of the body. So it creates a dry mouth. And in addition, to the vocal fold dryness. So that would, avoiding or reducing the amount of, say, caffeine, that will give the vocal folds a better chance to be hydrated.
Interesting.
Another thing is, if someone, say, for example, smoking, of course, obviously they have to make a decision. And one of the things that they are not just affecting their lives, they're affecting other people's lives, especially if they have kids. The kid's voice is going to be changed.
Oh, interesting. And that's something that doesn't really even get talked about. You hear about the secondhand smoke and it's lung disease and colds and all that kind of stuff, but you're saying that's going to affect the child's voice as well.
Right, and not just that, it will make the child more likely to have middle ear infections, and it will have the child more likely, I think about more than 30% chance to have tooth decay.
Tooth decay?
Yeah, and also ADHD.
No kidding.
It is very serious, So if people who are smoking, they really should pay attention to kids around, and they shouldn't smoke in a closed apartment or closed, especially in like winter. That is going to have an impact, especially kids.
I'm fascinated with the tooth decay thing. How does this secondhand smoke promote tooth decay?
The mechanism is, people would be inhaling it, and I think it affects the surface of the tooth and the bacteria.
The healthy. There's good bacteria and bad bacteria. So the smoke affects the good bacteria that fights the bad bacteria.
Well, I don't know exactly the mechanism how it works in terms of dental decay.
Okay.
But the research is saying that more than 30%, the child will have a greater risk, 30% more chance of having tooth decay. And the same for middle ear infections.
Wow.
So, that when you think about middle ear infections by themselves, they will lead to learning problems, and they will lead to language learning difficulties and a lot of issues that could be simply, avoided. If someone, just pays attention to not smoking around kids. And the fact is, also 3 or 4 years ago, they started working on third-hand smoking.
What's that?
And, like if you go to sleep in a hotel, someone used that room before you.
Okay.
And the smoking effect is in the sheets
Okay.
or the walls. Or you have a car that someone had smoked in.
Yeah.
That is third-hand smoking.
Okay.
And there is an effect on health. So imagine now third-hand smoking is dangerous. Second-hand smoking is more dangerous. And what it does to the person who is smoking is even,
Sure. Yeah. No, it's just it's something to, if you smoke, please quit.
Yeah, it's very sad to see, when we work in the hospitals with people who have the voice box completely taken out.
Yeah.
Because, of cancer, for example.
Yeah.
Smoking is known to cause 57 kinds of cancer, different kinds.
Wow. Food for thought. Anything else?
Yes. In terms of the breathing patterns that we use.
Oh, this is big. Yeah. Let's talk about that.
If you can look in the mirror and see as you talk or as you breathe, if you see your shoulders lifting up, that is not good. It shouldn't be the case, because up in the thoracic cavity or the chest cavity, the top areas, like the upper ribs, do not move much. There's not much space, because the cartilage segments that connect the ribs, the upper ribs, to the chest bone, they are very limited, and they do not expand. And the greatest expansion you can make is at the lower part of the rib cage. Mm-hmm. So the best way to breathe is called abdominal breathing. And again, if you look in the mirror and see that you are moving up your shoulders, it causes a strain on the shoulder girdle, and it will cause laryngeal tension. And laryngeal tension eventually will lead to voice problems. So again, watching our breathing habits, one way to make sure that if you want to teach yourself how to do that, is to lay flat on your back on the floor and breathe, and see just your abdominal cavity just going up and down gradually, and in an easy way, without moving your shoulders or the upper segment of your chest.
I have a question on that whole thing. I work with a trainer, and he's always trying to get me to breathe lower. And when I do my voice work, I try and breathe abdominally or diaphragmatically is another way to say it. And I know you're not a medical doctor, but you know an awful lot about the anatomy. Could the pressure that we're putting, if we start to breathe up thoracically, can that put pressure on our heart and other parts that could cause other issues?
No, it would cause more skeletal. It would cause the joints to be not normal. You could hear clicking in the shoulders and the girdle around. But
and the stiff neck and all that?
It could, maybe.
Okay.
But eventually, that effort, all the chest muscles that we use for breathing, some of them are connected right on the larynx. And the voice box. And the sternum, for example, also is connected. It's a muscle called the sternocleidomastoid that connects the larynx to the top of the shoulder girdle. Yeah. So that is one of the muscles that is used to stabilize, the larynx and the neck. And there's a whole bunch of muscles that hold the larynx in place while it is vocalizing, for example. Tension in one area could lead to a sequence of tension in the laryngeal muscles and, the ones that control eventually the vocal folds. So that will cause vocal fold problems.
That's fascinating. It's all connected.
It is. It indeed is. One of the other things is if someone has a hearing loss, if you raise your voice more than usual and you keep talking in a loud voice, that will cause voice problems. So when I see sometimes some people who have hearing loss, they do not realize that they have hearing loss. So they raise their voices because they think other people will not hear them. And so because they themselves cannot hear themselves. But, with a hearing aid, that could be immediately change. They will start to lower their voice because they can hear themselves better.
Okay.
In addition, raising when you speak in a very loud voice without realizing, that could cause also social problems with the spouse, with the family members, and
right.
it causes a little bit of tension, when you speak.
It's all those subtle cues that we refer back to that we started talking about when the raised voice implies the person's a little annoyed, and why you're always annoyed with me.
Right.
So these are all these little cues that everybody's still picking up on that you might not be if you're not hearing yourself, so you raise your voice, and you're like, why are you yelling at me? I'm not yelling at you. That kind of thing? Is that what you're talking about?
Yeah. It is called sensory neural hearing loss. If someone has it, which is damage in the inner ear, which that kind of hearing loss, it is not changed. It's permanent. We need a hearing aid will make a big difference in that regard. Mm-hmm. And the person typically can't hear himself or herself, so they raise their voice. And when they raise their voice, they are not realizing that it is very loud for other people.
Okay.
Occasionally, at the end of the day, just kind of massage around the area, around the neck area, and the throat, kind of, just massaging it. It relieves a lot of tension.
Oh, okay. So this is something that somebody can do at the end of the day, is just kind of rub their neck and their throat.
Yeah, and especially if, you work for a couple of hours and you feel like you're starting to feel some kind of a strain and the voice is starting to change, because it changes throughout the day. Your voice is like crackly in the morning as you warm up, and then half hour later you begin to do normally, and as you continue talking, it becomes more strained and the pitch changes through, until the end of the day.
Here's an interesting question for you. Could you say, based on what you just explained, is there a peak window for somebody who's a voice actor for them to actually say, okay, between these hours, my voice is at its peak, and these are the hours that I should devote toward recording whatever scripts that I may have, and then use these other hours in the day to do other activities around my business? I mean, I know there's not one size fits all, but can you kind of give us, is there something that you can recommend?
Usually it will be best in the morning. And again, like you said, the variations among individuals do exist. Mm-hmm. So some people can tolerate more than others. But in the morning, ideally, like a few minutes to warm up and stuff, and then that is the best time in the day. Mm-hmm. And you can, say, for example, if you are going to talk for 6 hours, throughout the day, your best chance is early in the day. Like maybe after you speak, like for maybe 20 minutes or half hour. And then from there, that is your optimal time. For the first hour is your best, and then it will slightly decrease as you go. And if you, say, take a break, a nice long break, like 2 hours or so, then you would be able to get the muscles to kind of rebound again, and you can get,
so you can
nice
you can take a break during the day, like you just said, like a 2 hour window is enough time for it to recuperate.
Yeah.
Okay. Yeah. It's still not going to be as good as after you've had 6, 7, 8 hours of sleep.
That's right, absolutely. Okay. Because muscle tissue repairs itself while you are sleeping, and anything that like chemicals, the body replenishes. Chemicals that we use for muscular movements, neurotransmission during sleep mostly. And to the extent that some people with neurological disorders, if they sleep, take a nap in the day, like a couple of hours a day nap, that could reduce the amount of some medications. Several years ago, that was in the case of people with Parkinson's disease, for example. Well, they say just if you take a nap, a 2-hour nap every day, that will make
your body will replenish whatever the chemicals it might need. You might not have to take as much medication.
The paper that the neurologist discussed with us then, like actually 2001, and he said it was 30%. They could reduce the amount of medication. A lot has changed since, and but the fact is that sleep does a lot, too. And once you wake up after a nap or after you have slept, that is your optimal chance that the muscles are functioning best.
Interesting. Doctor, you're basically saying to people, make sure they get enough sleep.
Really, sleep is a huge issue, and this is one of my interests. In terms of, there's hardly any skill that is not affected by sleep. Your physical health, even your emotional health. Sleep causes what is known as some kind of, they call it emotional intelligence.
Okay.
That people do not do well if they don't sleep well, and even you would not be able to have empathy for others. Socially, it affects their social relationships when they are not sleeping well. And the tension, and of course the heart disease and the strokes. It really, I do presentations on this, and it is frightening what sleep deprivation causes. In adults and teenagers and children.
Interesting. Did you have another point that you wanted to make?
Just, I think the last point I wanted to make is avoiding vocal habits. For example, if someone clears their throat frequently without a reason, they should replace this with a cough. One gentle cough should clear whatever you have, and take a sip of water. Mm-hmm. But there are people who might clearing their throat, so they have vocal tics and stuff like that.
Like a little nervous, like,
sorry. So if they do this on a regular basis, that is not a good habit. Another one is avoiding what we call, hard glottal attack. Like instead of saying, I am, say, I am, not slamming your vocal folds like that. Just maybe adding a breath of air before the hard sound that you say, so that you glide over the sound rather than slamming it. Instead of saying I am, say I am.
A as opposed to A.
Yeah, exactly. So, again, these techniques you are going to find a lot on, I have a couple of websites that you will find helpful resources on.
Sure. That's actually what I wanted to ask you is we do have to watch the clock, and I really want to thank you for all the information you've just shared with us. This has been fascinating. If people do want to learn more about this, where are some good resources that they can check out?
One is the American Speech Language Hearing Association, and it's ASHA, ASHA.org, ASHA.org.
Okay.
And it has resources for patients and for students, and it's a very, very good website. Another one is the American Academy of Otolaryngology, Head and Neck Surgery, and then you can Google this, and you'll have the link.
If you can send me that, I'll put that in the show notes for the episode, so that we'll just put the link right in the episode.
Okay.
People can click on it.
And they have a whole section, a whole page on voice and things that you do to protect your voice. And, for example, if someone has a problem, they have resources, national resources.
Excellent. Yeah. Well, Doctor, this has been fantastic.
No, thank you so much for the opportunity, John.
Yeah, this has been great. Thank you.
Thanks.
Well, that's it for this episode of the VoiceOver Marketing Podcast. If you like this podcast, please subscribe to it at voiceovermarketingpodcast.com so you'll get notices of new episodes, and please share it with your friends and colleagues in the voiceover world. Also, it would be a huge help if you'd like this podcast and rate it on iTunes to help keep it near the top of the list. Feel free to share your comments and questions about this episode and future topics you'd like discussed at voiceovermarketingpodcast.com. And if you'd like more information on one-on-one coaching with me and mastermind group opportunities where we focus on growing your business, feel free to drop me a line at my cyber assistant's email address at mike@johnmelly.com. Thanks for listening. Now go out there and share your voice with the world.